strong.
You know what's annoying me about this kid who killed this CEO is none of these news programs are talking about the incredible lack of empathy from the general public about this because of how these insurance companies treat people when they are at their most vulnerable after we've all given them our money every fucking month and now we finally need you and all you do is deny us. And then these pussies and all of these things are taking the pictures of their CEOs off their websites. You know, I got to be honest with you, okay? I love that fucking CEOs are fucking afraid right now. You should be. By and large, you're all a bunch of selfish, greedy fucking pieces of shit. And a lot of you are mass murderers. You just don't pull the trigger. That's why it looks clean. That's why these people look, oh my God, oh, he was just, walking into a hotel. It's like, okay, but what was his job? Results of it.
Crime is legal in this country if you wear a suit and tie. That's how it works. How many Wall Street bankers, the subprime mortgage crisis, and the Great Recession, how many went to jail?
Okay, so let's read some comments. The comments. When the rich robs the poor, it's called business. When the poor fights back, it's called violence. I don't know if Mark Twain actually said that, but that is a good quote. If kids at school have to be afraid, I'm sure CEOs can take it. Peaceful world cannot long exist with 1/3 rich, 2/3 hungry. Jimmy Carter. Those who make peaceful revolution impossible will make violent revolution inevitable. It's a class war about time. Our side defended itself. But the 1% has theirs instilled in policy. They have the right to do that. When the poor reacts, it becomes a crime. So just so you know, I don't know how it's going to affect policy because the people up there, they get handout from them. So I I see this as a sad case for people in the middle class and the low class, even the rich. Some of the rich people cannot even afford health insurance. It makes them go bankrupt. So I always say the wealthy because the the Elon Musk, they're the ones who can afford this kind of health insurance. And I'm pretty sure they even get a discount from these big companies that run these health insurance because I'm sure they're friends. I've heard more talks about healthcare since UHC murder than all the politicians combined in the last 4 years. Yes, this boy brought up the topic that has been burning in a lot of people for a lot of years. The first time, people, 18-year-old or 16-year-olds hear about insurance, they're like, so I'm just gonna be paying every month, even though nothing happens. At the end of the year, will they give my money back to me? No, they're not gonna give your money back to you. They're gonna keep your money for no, the number of years you keep paying to them. And when out of those, I have a 60-something-year-old friend got an accident only once, and it took them a long time just to get a new car, a new you know, a new even a new ride. So you can imagine if the car system is this worse, ooh, the healthcare one has killed a lot of people. It has. It has taken a lot of lives. And that's why a lot of people are saying they indirectly kill these people. It's not even indirectly because you know what they're doing. As someone forced to live in chronic pain, I have no sympathy for healthcare mafia bosses. Like you said, people are talking from experience. Access to education, access to healthcare should not be for profit. So you can imagine if some people lost, let's say, uh both parents from these bad healthcare systems that are available, and then Luigi takes out this guy. How do you expect this person to feel sorry for you? They cannot feel sorry for you. I'm so just sorry that it doesn't work that way. Not in this life. It just doesn't work. Oh, I'm so sorry for the noise. But yes, I just wanted to bring to you some of the comments. We're gonna get two more comments. I'm gonna be reacting more to these different healthcare reactions to you know the United Healthcare CEO killing. And Luigi and Gioni, we're gonna follow his case and see where it goes. I just pray and hope for, no death penalty. I think he should be punished. I just don't think he should get the death penalty. I just don't. That's my opinion. I just don't think. I think he should be punished. He should not be let go free, but he needs to be punished. That is serving prison time and not getting the death penalty. Well, we'll come to you again with more. Thank you, and sorry for the background noise. Bye. Hi, guys. So this is uh, some of the backlash that has been happening about the alleged alleged killer of the United Healthcare CEO. So these are some of recordings to let you know how bad their American healthcare system is. You would think it's a developed country, but the insurance and the healthcare system is worse. People pay monthly health insurance if they can afford it. And then when it comes to claims, there's a lot of delays. And then a lot of people have died because of their claims being rejected or not being approved. So this is how some people in the UK are reacting to it, the ridiculous high prices in the healthcare system in the US. Let's listen.
75 to 100
$1
$1 million? What?
On average, about $2,500.
Ouch.
Literally.
I can't tell if this is a joke or not. Mind blown.
I can't even pay for the bus, man.
N95 mask, so like a good one, like one of those dust masks. Pack of 5.
Oh god, I'd say maybe like $5.
It's about 60.
60
For a pack of 5 masks? Yeah. Are you sure? Are you being serious?
I am being serious, yeah.
I can't tell if this is a joke or not.
No, I'm being totally serious. It's how much it's how much it costs, yeah.
And why is that? Do you know the reason why it's so expensive?
People like making money.
£12 for each.
Yeah.
Nowadays.
Yeah, so a pack of 5 is $60, yeah.
It's made in China.
You've been doing American things, you've been at the NASCAR, you've been to Hooters, and you think you might have got COVID. Right. You're going to do a lateral flow test.
$20?
Yeah, bang on. Yeah, $24 for 2 lateral flows.
Would anyone actually do that?
I have no idea, to be honest, because like here it's for free, right?
Yeah.
Basically, I think £2 for.
It's $12 per test.
Oh my god. Oh, that's disgusting.
Yeah.
That's terrible.
You feel worse.
Yeah.
You need an ambulance.
Okay.
How much does an ambulance cost? Call out in America.
I don't know, $100?
No. Way more.
Should I go up?
Yeah, you should go up, yeah.
$200.
Times that by 10.
No.
Yeah, what, like upwards like $200?
About 2,500.
Oh my god! That's horrific!
Yeah.
For an ambulance journey?
Yeah.
On average, about $2,500.
Ouch.
Literally.
And then you just get sent that bill.
Yeah. If you're uninsured, yeah.
Bye! I'm sorry!
So, you are an American.
I am, unfortunately. We always like to say get a Uber or a Lyft, don't get an ambulance because it's going to be a lot of money.
You would get an Uber to the
Oh,
hospital.
absolutely. The ambulances are ridiculous.
So I'd rather be die at home, alone.
For a person under 40 who stays in an American hospital for more than 2 weeks, what do you think the average medical bill is?
I mean, after the ambulance being $2,000, what, 20 grand?
More.
More?
It's way, way more.
Oh.
10 grand. If No.
Way more.
To be honest, I thought I was getting quite well then.
Yeah.
Okay.
A lot more.
30 grand.
No, more.
Are you kidding?
Yeah, no, I'm deadly serious.
For 60 grand.
75 to 100 grand.
$1 million. It's $1 million.
$1 million? What? What, for like a stay in hospital?
Yeah.
Costs you $1 million?
You know, but we're talking lots of medical care is being given to you here, Ralph. You know, you're being taken care of.
Yeah, you're being looked after, but $1 million. I mean, like, considering here we get it for free.
$1 million.
Oh, shut up. Are you serious?
Yeah.
$1 million.
$1 million.
Million.
$1 million.
That's a lot of zeros.
It's $1 million, yeah. For a very serious case of COVID, yeah, you're in there for a long time.
What, do they not have the gear or something? Who even... How would you even have that money, like?
And it can bankrupt people. Some people are like a broken bone away from just being completely broken on the streets.
The federal government, if you die of COVID, they'll contribute to your funeral costs.
Great.
That's kind of them. I mean, I guess you kind of get the money back, but...
They're like, yeah, I mean, we'll keep you alive, but it's going to cost you like an arm and a leg, pun intended, and then you're going to die, and here's $9 grand to die.
Have you had to pay for any health-related costs in relation to COVID during the course of the pandemic?
No, I've had COVID and I haven't had to... No.
Sanitizer, but sanitizer isn't like expensive. Soap, like I hadn't had to pay for anything.
That's so if you're broke and you were to like, I don't know, die of COVID, or if you were to have COVID and it was kind of like the kind of severe symptoms, you probably wouldn't afford to survive.
Because I had to self-isolate and I was getting sick pay for self-isolating, which was quite nice.
Free tests on the NHS, yeah. It was a bit difficult getting lateral flows, but I haven't had to pay, so...
My PCR tests that I've taken have all been free ones.
Well, COVID hit, my mom lost her job and we lost our insurance, and then it was very stressful, and my mom's immunocompromised, so it was difficult to be so stressed about it all the time, and to think that like so many Americans are just like in complete fear of like medical costs. And it's insane. I don't know how they can keep on going like that.
For ordinary people, especially for somebody like they don't earn a lot of income, that's a challenge for them in the difficult time. Yeah, absolutely. Yeah, that's unfair.
Okay, so that's the UK or British reaction to the ridiculous healthcare system here in America. And this was during COVID. So it wasn't even now, it was during like 2 years ago, during COVID. So this was not now, this has been happening like a long time ago. And the United Healthcare thing was just like a problem waiting to happen. But if you watch a lot of the interviews, the big people who can actually make a change so far, they've all just been talking about how aggressive it is. Nobody's talking about making changes to the government. Nobody's talking about making changes to the healthcare system. So you can see how I always thought it was a waste of time. Well, it wasn't a waste of time. You can see that it brought a lot. You can see a lot of people are supporting, the agenda he had. Nobody's happy about the person who died. I don't think people are happy because the person died. They're just happy that it's highlighting something that they've been worried about for a very, very long time. That is just what I think it is. So let's see how this case goes. Keep you updated. And then thank you for watching. Bye.
Segment for you guys here. Good googly moogly. So there has been just a colossal, massive propaganda effort in the US to pull the wool over your eyes and hide the truth from you about just how shitty our healthcare system is. And look, the health insurance companies, the big pharma companies, you got these giant industries. They give a lot of ad money to these mainstream media networks. And so you really don't get deep dives on just how wretched and repulsive and grotesque our healthcare system is and our health insurance system is, right? So this is going to be an eye-opener for many of you. Many of you already know this reality, but you know, for those of you that don't, you're in for a treat here. So first, let's start with this. You have Abba and Preach. They are Canadian YouTubers. They're going to talk about the U.S. healthcare system here. Specifically, they're reacting to the United Health CEO getting shot and killed. Let's watch, and then I got some other incredible videos for you.
Us who don't live in America, right? I go and I get injured. I go through the free healthcare program. Eventually I'll get there. Is it slow? Sure. Does it have its problems? Absolutely. In America, you have certain problems. If you don't have health insurance, you're looking at bills of 40, 50, tens of thousands. It's like absurd how much people sometimes have to pay medical fees. With that in mind, a lot of people have a lot of issues with the medical industry. Some people who need life-saving surgery or life-saving treatment can't get it because they don't have insurance and they can't afford to pay for it.
The point of the insurance is not to pay. It's to make money. So they're going to find a way. They're trying to look for all the instances of where it might have been or not been or whatever, and looking at the fine prints. When it's time to collect, they collect. But when it's time for them to pay out, they're going to, let's see about that.
In my opinion, beyond even this man or his company, this kinds of industry shouldn't exist. I don't think there should be a standard anywhere in the world, in my personal opinion. Because I think health insurance stuff and how it functions works really well if you got money. If you got money and you can pay for some of the best coverage and all that shit, it's great for you. But for everybody else, it's fucking trash. And knowing that, like, yeah, we can talk about this guy, people can hyper focus on this, but honestly, that's an industry, in my opinion, I can't believe exists to this day. But that's me. And I'm not trying to sit here and say, universal health care that we have in Canada is perfect. It comes with its flaws. But good Lord, I've never looked at the American system and thought to myself,
that's great.
I could handle being a poor person in that shit.
By the way, we talked about this. The way they prioritize who gets the care in single-payer systems is literally by need. Who needs it the most? They hop right to the front of the line, right? It is the most rational, logical way to determine who gets the care. Look at need, go based off that. In the U.S., we do what's called a wallet biopsy. Who gets the need? Who's got the most money, right? And so that's a shitty system. So are there, in some instances, some waiting that you have to do in Canada or other single-payer countries? Sure. But usually the waiting is more for elective procedures, right? And if there is some waiting for a necessary procedure, it's literally just, this is as quick as we can get you in, but we know you need the care, so you're hopping up as high as you can in that line, right? Whereas in the U.S., that's not how it functions. That's not how it functions. The wallet biopsy is the end-all be-all, and there are terrible wait lines here as well, and you could be on that wait line even for care that is absolutely necessary. And forget it if you don't have insurance. You're going to go bankrupt. Medical bills are the number one cause of bankruptcy.
You guys who love it, you guys got money. And most places in the world are always going to be amazing if you got money. Even here in Canada, if you got enough money, you can go through a lot of procedures and get shit done. It don't matter.
And when we talk about having money, we're not talking about like being dirt poor, and like the opposite, being dirt poor and everything like that. Just working class. If you're not well insured, we're not talking about like, I ain't got no money to put. No, there's some people that have a roof over their head. They pay their bills. Everything is all right. They have a decent job. And then some stuff happen.
Yep.
And it's done. It's really an injury at work, or an injury, a sickness. And they were good before that. And they had insurance, but not the proper insurance that covered whatever the hell happened. You understand? When we talk about people that don't have money, it's not even the poor people. It's not even Section 8. It's not even all of that stuff that you're talking. It's mid-class, even higher class citizen. It's just like, yo, how many $40,000 bills can you pay? After how many months are you going to be all right? And if we think that in America, it's like, I think it's like the number for that is like 60% of people are living check to check.
Yeah.
So if you're considered good with the money, it can still break you.
I have friends who refuse to go to a hospital because they know they can't afford it.
100%.
So they've been walking for years with an injury like a shoulder that's like not in the proper spot or whatever.
We talked about this the other day. U.S. could have saved 338,000 lives from COVID if we just had universal health care. 338,000 for the exact reason he's describing. Some people were really, really sick with COVID, and they were like, I should probably go to the hospital. But then they said, I don't have insurance. That could bankrupt me. I guess I'll ride it out. And then they died. Does that sound like a system that makes sense to you? Does that sound like it's how it should be? So that's a Canadian reaction to our healthcare system. Yep. They were reacting to the shooting of the United Healthcare CEO. but I got more for you. This is an older video, but man, is it important. Here is somebody on the streets, how screwed over we are.
I love Monday.com.
What's Monday.com?
You don't know Monday.com?
All the statistics when it comes to the same thing. If you live in the U.S., you can understand what people are going to
in this country has brainwashed some Americans into thinking
why some of these things happen, and we're just hoping it goes well for everybody. But we do know that the healthcare system has been killing a lot of people. It has. Even if you have insurance and you're filing for a claim, the delay alone, and it's not just healthcare. Even what's the name? Auto insurance, they do the same thing. They delay. But a lot of people are worried about the health insurance because that is between life and death. If your car doesn't work, hey, you can fix it later. It will be fine. It's just a machine. But the body, your health, it should be at the top of the list. We'll see what the Secretary of Homeland Security says after we're done with.
we actually have it the best in the world, bro, and everybody else. So to give you some more, you guys have seen this before, but it's super important. Medicare for All would save $450 billion annually while preventing 68,000 deaths, new study finds. $450 billion, because you're getting rid of the unnecessary, rapacious, for-profit mafia middleman who's price gouging you for no fucking reason, getting in between you and your doctor. You're getting rid of that. And also, the administrative costs in Medicare for All would be 2%. For current Medicare, it's 2%. The administrative cost for private healthcare is 18%. 18. European versus American healthcare. Discover the differences in healthcare between Europe and America, modern European U.S. healthcare comparison. So, there's a chart in here somewhere. Here it is. The U.S. we spend about $13,000, $12,500 healthcare costs per capita in this country. The average developed nation, they spend $6,400. So we spend double what other countries spend on healthcare, and we have worse health outcomes, tremendous number of medical bankruptcies, and 68,000 deaths every year. It's a scam. It's a scam. Health insurance is a mafia in this country. One more for you. Ranking U.S. healthcare. So every couple of years, this group called the Commonwealth Fund does a study of a bunch of the developed nations and their healthcare systems. Virtually every year, we come in dead last. One year they studied 11 different systems. We were 11 out of 11. One year it was 7. One year it was 9. Dead last. The only thing we're good on is the care process, they say, right? But care access at the bottom. Efficiency, close to the bottom. Mm-hmm. Equity, the bottom. Outcome, the bottom. So they have all these categories. Hey, how is the healthcare system in this area, in that area? And we just shit the bed virtually across the board. It doesn't have to be like this. It does not have to be like this. It's like this because of the oligarchs and the robber barons and the donor class that have bought our politicians to look the other way as they price gouge you and deliver us horrific healthcare for profit. Doesn't have to be like this. We can ban private health insurance. We can do single-payer Medicare for all. It just takes the political will to fight, to stand up, to view this as one of the civil rights fights of our time. That's what it is. Look at those reactions from Canadians, from British people. Look at those reactions. They're laughing. They're like mocking us. I mean, they feel horrible for us, but they're laughing. They're mocking us. They're like, oh my God, do they have no idea how screwed they're getting? How a mafia controls their health for profit? Should be an eye-opener. I'll say it again. Go watch Sicko. All right, guys. That's the show. Love y'all very much. Everybody click that bell icon so you get a notification every single time something drops. You can leave a comment, tell me how sexy I am. You can support the show on Patreon.
Liberty Mutual customized my car insurance, so I...
It was what he says. I always thought, this shooting up the healthcare CEO was not going to get it was going to get a reaction out of the public, but was not going to put any change in there because these um, insurance companies are the same individuals or private institutions that sponsor these politicians when they have to do their campaigns. They are the ones, pushing more money into these various campaigns. So we know very well it wasn't going to get anywhere. It was not going to get anywhere, but it was going to get a reaction so they could see that just because you're not part of the 1%, which is, the wealthy class, you are not stupid. We see what they're doing. This reaction is just letting them know that we see what they're doing and we know what they're doing. Um, Nobody's condoning what the guy did. It was just bringing all these hidden, atrocities out, and the public is just reacting towards it. I'm sad, the 26-year-old had to throw his life away for this to show, and for, is it a 50-year-old man, to also, throw his life away because of this. But I hope we can prevent more lives from being lost. Those in the healthcare system, those who are, receiving insurance, and also, I don't think any more CEOs are gonna be, you know, shot at anything because I'm sure security is going to be like at 100%, or even 100%. I'm sure security will be like at the 500% right now for all the CEOs. So I'm sure they're fine. It is the regular person, the middle income, the low income. Those are the people that we're worried about. Why? Because they're just gonna keep dying. There'll be a lot of people who have died because insurance was rejected. They did not have insurance, and that is the fault of how the insurance system is being run in this country. Let's see what
Biden's Homeland Secretary Mayorkas, he's asked about Luigi Mangione and the charge of terrorism. And I think this clip says a lot. The way he responds here says a lot. Here we go.
We recently saw that killing of the United Healthcare Division CEO on the streets of Manhattan. Manhattan prosecutors called it a killing that was intended to evoke terror. Would you consider him a terrorist? Is this domestic violent extremism?
The rhetoric on social media following that murder is extraordinarily alarming. It speaks of what is really bubbling here in this country, and unfortunately, we see that manifested in violence. The domestic violent extremism that exists, the threat of it in the United States is one of the great threat streams that we must counter.
But when you say something's bubbling, what's the national trend that you're seeing?
Look, we have been concerned about the rhetoric on social media for some time.
And that's against CEOs, that's against the government, that's against leadership?
We've seen narratives of hate. We've seen narratives of anti-government sentiment. We've seen personal grievances, and the language of violence accompanying or being a part of those narratives is something that we're very concerned about. That is a heightened threat environment. I still am alarmed, though, by the heroism that is being attributed to an alleged murderer of a father of two children on the streets in New York City.
And a lot of that seems to be around the healthcare industry and what that company was doing. It's depersonalized. The victim is depersonalized.
And the victim is a person.
Yeah.
And the victim is...
No talk about the health insurance company. They're just worried about their reaction. Well, the problem here, the basis, the background of the problem. It's not Luigi, it's what Luigi brought out. That is what I think the lady was trying to get to him. But they're not ever going to answer this question about insurance. I always knew this was not going to get anywhere. There's not going to be any change in insurance companies, how they operate. It's not going to change. It's just like the gun issue. So it's just weird that people who go into schools to shoot kids. We have elementary schools that had school shootings. These individuals were never charged with terrorism crimes, but this is one person to one person crime, and it's being charged as terrorism crime. So you can see where priorities are. he never mentioned anything about health insurance, and this is somebody representing the government. So you see where this is going to. It's not going to go anywhere. They're just going to punish him. I just hope they don't do that penalty because I don't think it's needed. They're just going to punish him just to make sure other people don't do it again, and then they're going to make us move forward. I think an older lady was arrested just a few weeks ago or days ago because her insurance claim was being rejected, and she made a comment about, delay, deny, depose, which was on the shell casing of the Luigi's gun that he used. So they just want to curb the reaction from the public, but not fix the healthcare system from this interview. That is it. That's all you're going to get from it. It's not never going to be fixed. This is a capitalist society, and they want individuals to be rich. They just want a few people to be rich up there. The rest of the people should be poor down there and suffer. It is just that is it. Nobody wants to,
and the victim is a father.
So there's a couple interesting parts of that.
That's it.
First of all, the continued reference to social media. There's a hint of like, yeah, we got to do something about this social media problem, right? And look, on the one hand, I can understand the perspective of like, there truly is a lot of just misinformation, disinformation, malinformation, Nazi lies, whatever, shit that spreads like a cancer, right? And it shouldn't. That's true. But any attempt to sort of regulate it, you're probably creating a bigger problem than what you're solving, right? Because who's going to watch the Watchmen? How do we know? Oh, everybody who makes every rule to determine what's acceptable and what's not. How do we know it's true? Like, I honestly think the best you could do is something like Community Notes, and even Community Notes misses from time to time. Like, anytime they've ever said I got something wrong, they were wrong, obviously, right? So the social media part is interesting, but the rest of it, man, it's...
Okay, so the next tool I want to show you is called Highlight. Absolutely with this app. You should see this. It's a personal contextual assistant for your community.
They're really pulling out all the stops to try to or conversation, right? And even the host was trying a little bit, like, what about this angle? What about that angle? And just not taking the bait.
Yeah.
Not taking, like, the whole point, the reason why the reaction is what it is, and this is what these people will never admit, is United Healthcare is a criminal organization. They have the blood of tens of thousands or hundreds of thousands on their hands. That's why the reaction is what it is. Because it's like, okay, the criminal, gangster, mafia cartel, which is a meat grinder for human beings, which rejects claims and people die or leads to people going bankrupt, the CEO of that company got killed. And people almost feel like, okay, you got one person down on this end of the equation, but the company itself has tens of thousands of innocent victims that they've created. And so there's just no sympathy, right? That was the overarching reaction that I saw. It wasn't even people being like, hooray, murder, we love murder. That wasn't it. Like, the point of it was more, I just don't feel sympathy in the same way that if some plantation owner got murked by a slave, you'd feel like, like, what'd you expect, right? Like, what'd you think was going to happen, homie? Like, trees are just by their very nature cruel and criminal and violent and malevolent, right? Like, if somebody were to take out the head of the IDF, how do you think people are going to react? Oh, he was a father and he was a son and he was amazing. He really liked eating Subway sandwiches. Like, people are just going to be like, games win shitty prizes, right? Like what'd you expect? You're the head of an army that's literally committing a genocide as we speak, right? And in the case of the health insurance industry, I underestimated the American public. They genuinely and sincerely know already that whole industry is bullshit, that the whole thing is a fucking scam, that the whole thing is a...
Like I said, this is just showing that they know. I don't think the upper class or whatever they are, well, the wealthy or the government kind of knows that majority of America knows that, hey, insurance is just a scam. It's fraud. If you're going to arrest people for providing fake documents, if you're going to arrest people for, you know, going into these fake marriages, why don't you arrest the insurance? The insurance company is also fraudulent because why do you take somebody's money every month and then when it's time to claim it, we've had people who have contributed to insurance for more than 30 years. They get one accident and then they jack up their prices. Their premiums go up and then they have to delay even in, getting those claim out. So it is a fraud, it is scam. That's what it is. It is just purely scam. Unless you're not going to think about it or you're part of the 1% upper class, then yes, you don't have a problem. But those who have experienced it, those who have not experienced it and are just sitting on the sidelines watching knows that is a huge industry of fraudulent
Mafia,
people.
that the whole thing is an unnecessary middleman that price gouges you and denies you care whenever and however they can. People really get that. People really understood that. And it is not like you saw people who were on the left, on the center, and on the right, all with the same reaction. Go read the comment section on the Ben Shapiro video or the comment section on the Matt Walsh video. Everybody's like, yeah, that's what it is. You had Bill Burr, the comedian, came out and was like, look, I'm happy that CEOs are afraid again. Because you did see there for a little bit after, I don't know if it's continued, but you did see for a little bit after, suddenly all the claims were getting approved. Where, the executives were like, shit, okay, what we're doing actually has consequences and is actually affecting people's lives, and we can't just get away with anything and everything we want to do. And all of a sudden you started seeing a bunch of claims being approved, right? So the idea that they have no interest in having the longer conversation, the deeper conversation. Because by the way, there's an easy way to prevent any future Luigi Mangionis from happening. It's called single payer Medicare for all. If you don't have health insurance executives exploiting the entire country, price gouging them, robbing them, and denying care on the back end where some people end up dying or some people go bankrupt, if that job didn't exist, there is nobody that anybody would feel the urge to react like that to them, right? That wouldn't happen. The industry would be cleaned up. The industry would be pure. There would be no health insurance industry. Again, every single developed country has one version or another of a universal healthcare system. And the best way to do it is a single payer Medicare for all system. The government is the single insurer. It comes out of your tax money. So when you get sick, you get help. It's fully paid for. That's the end of the conversation. It's just our tax money takes care of everything. And it saves money and everybody gets covered and there's things.
Every time we watch these things, you read comments. The comments are always, on board. Like he said, wish they cared as much about people who die from inability of health. Yeah, because you're saying you want people that are reacting the way they want to react to care more about a deceased, but you don't show the same care for them when they lose a family member or when they are not given, their claims the way as they're supposed to give it to them. The quality of care they're supposed to receive, they do not receive any of these things. You don't show the same care. I don't know why the 1% wants the American people to show them the care that they wouldn't show to a poor person or a middle class person whose claim has just been denied when they need a back surgery or when they're being put under whatever they have to be put under to go through surgery, and you're here saying, oh, after 2 hours we need to take you off whatever you're on during your surgery. Like they don't care about them. So if you understand from both sides, the upper class does not care what the lower class or the regular American goes through. So why are you forcing people to care about him? Because he's also a father. He's a husband. They were separated, but yeah, whatever. And he might also be a son or a brother to somebody. But you can't force people to care because they have gone through something you haven't gone through, and that's why it's just it's not even sad that it's majority of Americans because the first day the shooting happened, the comment section, even though they hadn't seen the face of the killer or the alleged killer, nobody knew how Luigi looked like before they started supporting him. As soon as they had that the person who was shot was a healthcare CEO, the comments section, I would go to previous videos so you could see it. I said the comment section before, they could see how Luigi actually looked like. The comment section was full of support for what happened. So it's not about having, pity for somebody when them, as people who are suffering from these policies, these claims being rejected every time, are not being considered in any way. Well, thank you for watching. I just wanted to expose America to you a little bit so you can see the good, the bad, and the ugly. Bye. We'll see you later for more news.